Hello, everyone, and good afternoon. I'd like to welcome back and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases right here at Northwestern's Feinberg School of Medicine, who addresses the latest COVID news and answers your COVID questions every Tuesday and Thursday right here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering your questions and addressing the latest COVID headlines through today, the 26th of April. And should you have a question, we invite you to email us at globalhealthinstitute@northwestern.edu. And leading the discussion again today is our student research assistant, Sophie Biskowski. So Sophie, I now turn it over to you.
Thank you, Kristen. Hi, Dr. Murphy.
Morning.
Now for some unfortunate news. The United States cases are increasing by 53% over the last 14 days. Yesterday in the States, we saw 74,612 new cases, and that is if you are taking a PCR. So we have no idea if that is entirely accurate. The booster shot rate is still at around 31-ish%. Hospitalization and deaths are both increasing by 4%. And in Illinois, yesterday, we saw 8,174 positive new cases, with cases going up 78% and hospitalizations going up 8%. 2 weeks ago, Dr. Murphy, we were seeing maybe 1,500 cases in Illinois. What the heck is going on in these last 14 days?
Pandemic's not over. We've loosened up our mask requirements and many mitigations, open venues, stop checking for vaccine to go into places. Guess what happens? This happens. So we're at the beginning of the sixth wave. There is no doubt about it. This is not going to be a big wave in the fall. This is a wave that is starting right now. And as we go through some of the headlines, we'll see what's happening around the United States and also in the world. It's happening everywhere. It is not just the United States. The Chinese with their zero policy, I mean, they shut down the 25 million people in Shanghai, still shut down. Beijing, now they're shutting neighborhoods down, it's just really everywhere. What's happened is that this thing has mutated to where it is even more transmissible. You've heard, Omicron was 50% more transmissible than Delta. And then the BA2 was 25% more transmissible. And the BA2 1.21 was 25% more transmissible than the BA2. And this just a broken record. And it's so contagious now, this thing. And so as soon as you let your guard down, guess what happens? And then the very unfortunate news or situation really is that it looks like herd immunity is never going to be achieved. Look at all the people that had Delta in December and November and before. They got Omicron in January. Some of those people were getting COVID twice, 2 different strains of COVID within a 30-day period. No protection at all from the previous infection. So the herd immunity from prior infection doesn't last long and can change by variant. And we know quite well that the vaccine immunity does not last very long. Starts to wane in about 4 months. It doesn't mean it goes away completely, but it definitely gets worse over time. That's why we have to have all these boosters. That's why they just approved the second booster 4 months after the last booster, by the way. Where does this go? Are we going to just have to boost ourselves out of this pandemic or just into the next thing? I don't know. It's really incredibly challenging, this pandemic. It is not over yet.
No, yeah, absolutely. And this goes right into our first headline that the mask mandates are returning to U.S. college campuses as COVID cases rises. And, I'm a student at Northwestern. Here at Northwestern, we have no requirements to wear masks. Will this be reinstated now that these cases are going up?
Well, it depends on the place, and different colleges and cities and places around the world have reinstituted mask wearing, at least. masks work. Indisputable. N95 mask works the best, but you just can't wear that all day. It's too uncomfortable. The surgical masks are second. And if both people are wearing a mask, it's better than if just one person is wearing a mask. Keep those fundamentals in the back of your mind. And Philadelphia reinstated the mask mandate. They saw the cases jumping up. They jumped right on it. Good for them. Some schools have done the same thing. And it's going to happen here too if the cases continue at the University of Pennsylvania and Temple, which are in Philadelphia. They have reintroduced them. There's been lots of pushback. People are tired, but being tired does not protect you from getting COVID. You can get sick from COVID. And if you're young, you can get sick. You can get long COVID. How would you like to have brain fog when you're trying to do your finals? We're going to have to live with this, and we got to figure out how's the best way to live with it. Think of some better types of vaccines, better treatment, oral therapy that's easily available that you can actually find. It's just crazy all over the place trying to treat this thing. The diagnostics, big success. You can go in the pharmacy now, or the government sent you a couple boxes of Binax now, or whatever they sent. Now it's easy to make the diagnosis. The cases are everywhere. And these cases that you're reporting, this is just cases done in a laboratory that were molecular based, because those are reported to the state. All the people that had the diagnosis made it with a home test are not included. So just take those numbers, which are scary, disastrous, and double or triple them, because that's really what the number is. So, somebody will wake up one of these days and, we're going to have to reintroduce these mandates. The other thing that may happen is that the Department of Justice has appealed the single judge ruling in Florida that stopped the whole airplane mask mandate. If they overrule that, that's going to go into effect the next day. So the mask will be back on public transportation. That goes for Metro and CTA, commuter rail, bus, all that kind of stuff will likely go back to what it was. I mean, I don't speak for them, but I mean, you're going to see that kind of thing. The difference between a restaurant and an event space and public transportation is that, if you're at risk and you go and you decide, you make a personal decision whether you're going to go to a restaurant where no one's wearing a mask or go to an event where no one's wearing a mask or social distancing or whatever. That's your personal decision. That's your right, and that's okay. However, everybody has to get from A to B at some particular point. You're mixing with all sorts of people, vaccinated, sick, coughing, sniveling, who knows, wearing a mask, not wearing a mask. It's a utility basically. And it's really not right to put everybody, particularly those at risk, which is about a third of the population, in a risky situation when we know what does work. I mean, it's just not hard putting a mask on, to go on a 2-hour flight in the United States, or, you can do it for 8 hours, flying to Europe, whatever. So that is likely to come back. By the way, in Europe and the rest of the world, you still have to wear a mask in the airport and on the airplane. They have not changed their rules.
Yeah, absolutely. And you just tied into vaccines so well. So that goes right into our second big headline is, will we ever get a universal COVID vaccine? And what does that mean? What can you tell us about this?
Yeah, this is just, we're at the concept level here, is to develop a vaccine that works for kind of all strains of COVID. I mean, this is a great goal. And I'm sure people all over the world are working on this. They're thinking the same thing for HIV. This vaccine technology has done so well, relatively speaking. Maybe other diseases we can also use this technology and do the same thing and improve the health of everyone worldwide. Great goal.
Wonderful. And now for our third and last COVID headline. Should people wait until the fall for a second booster? The CDC panel is now weighing it. What is the CDC panel now advised for individuals?
Yeah, so like I said at the beginning, unfortunately, having COVID and getting a vaccine, it works, but it doesn't work for all that long, and it can vary by strain. So we have to keep boosting and changing and maybe changing the vaccine. So right now, the second booster or the fourth shot is recommended for people over 50, or if you have any underlying disease, and the list is a mile long. It's basically everything. So, or it's many things, I should say. So that's recommended right now. Now, we haven't even got not too many over 30% who have actually taken the first booster. So, you should get the booster because those vaccines you took a year ago are probably not working anymore. So get your next booster, get the second booster 4 months after that. That'll help. Now, they're also re-engineering the vaccine to work better against these Omicron BA variants. And so if you're under 50, you should wait. I mean, first of all, you're not supposed to take you don't need the second booster if you're under 50 and otherwise healthy. Wait until late summer or fall when this version 2 vaccine becomes available. Both Moderna and Pfizer and the other companies are making they're making a different engineered vaccine, very similar to what we do with the flu every year. Every year your flu vaccine is different because the virus is different. So this is the same, and they're trying to make a universal flu vaccine too. So all this comes in together with the current technologies. And so if you're under 50, otherwise healthy, wait until the version 2 vaccine. You'll do better with that one than taking the booster right now. But if you're 50 and over or have some disease, just get the booster now. You'll have plenty of time and opportunities to take another booster later.
Wonderful. And now for some of our COVID questions. Is there a T-cell issue with the second booster shot for 65 and over?
So what this question is referring to is the part of the immune system that responds called the T-cell response or the cellular response. This part of the immune system is different from the antibody response. That's the antibodies get produced very quickly, and antibodies are cheap to measure. Everyone understands antibodies and whatever. So the cellular response or the T-cell response is what's protecting you from severe disease. And severe disease means going in the hospital and or dying. So there's got to be more emphasis on these vaccines and the T-cell response, because that's going to save people's lives and keep them out of the hospital. Remember Omicron, you had the hospitals overflowing again in certain areas. It was really terrible. So so this response is for that. And so in the last couple of weeks, the FDA has made some statements saying, hey, for any new vaccine, any new revised vaccine, let's see some T-cell data and start looking at that a little more carefully. It's not standardized. Every research lab has their own methods. You can't compare one to the other. It's apples and oranges. So I think that was a very good message to send out there, because we're going to have to live with Omicron and all the other variants for quite a while.
Wonderful. And now for our second COVID question. I understand there may soon be a vaccine for children under 5. I have 2 grandsons, 4 and 2 years old, and my husband and I watch 3 days a week. We've had all 4 vaccines ourselves. How soon do you think this vaccine will be available for them? And we're concerned about them getting COVID. How do kids fare if they or when they get COVID?
Yeah. So these vaccines have been tested in kids from 6 months and to 5 years of age, the ones that are currently not eligible. So up to 5. 5 is eligible. They've got to get the dose right. These are babies, they're smaller and whatever. And there were a couple misses at the beginning and some not so good efficacy results. And so now it looks like they've got the dosing and the interval right. And it looks like it's going to be ready by the summer for for kids 6 months to 5 years of age. And so that will also help, especially with these vulnerable grandparents or parents who have underlying diseases who are taking care of the kids, because the kids are continuing to spread the virus. So that's good news for the people willing to take it.
Wonderful. And now our third COVID question. My husband showed symptoms last Friday. I also had cold symptoms. We both took rapid home tests on Friday and Sunday. All were negative. But then on Monday, he tested positive with a PCR, and she's continuing to test negative. How long is he contagious for? Do you calculate from when he showed symptoms or when he tested positive?
Yeah. So they probably both have COVID. She might have just missed the window of when her test was positive, because I'm assuming these people are vaccinated. But anyway.
Yeah, let's assume they're vaccinated.
Yeah. So assuming they're vaccinated, I think they probably, well, the man certainly has it. The woman may have it, may not. But the infectivity starts from either whatever occurs first positive test or first symptom. So you go to the symptom, and then it's really a 10-day period before most people become non-infectious. And so, the CDC cut that to 5 days if your symptoms improved, if you just wore a mask. That was a compromise to keep everybody working, and if you feel fine at 5 days and you're not coughing or anything and you wear a mask, it's probably okay anyway. But it's 10 days from that first symptom, and if you have no symptoms, from the day of the first positive test.
Great. And now for our fourth and last COVID question, and COVID unrelated. Dr. Murphy, I was wondering if Dr. Murphy could talk about the recent headlines of an outbreak of hepatitis in children. It doesn't appear to be COVID related, but this is a really concerning story. I would like to know more about this and how concerned should parents be.
Well, I'd like to know more about it too. There is an outbreak of hepatitis from an unknown origin in kids, and it's international. Nobody knows what's causing it. Maybe it's an adenovirus, a virus that typically just causes a cold. They don't really know. It's all speculation at this particular point. But one thing, it's not the typical hepatitis A, B, C that we normally deal with. So it's something new, and it's in kids, and it's international. I think I read yesterday there were 9 cases in the US. And so there's bulletins out there saying for pediatricians, if you're seeing a kid with hepatitis, and it could be lethal, that this should be reported, worked up and reported. So make sure they don't have any of the usual causes of hepatitis, and stay tuned, because of course this is of intense interest, and we've got to get to the bottom of this, and you'll be hearing a lot more about this, because this is something that can be figured out.
Right, absolutely. Well, those were all of our COVID questions for today. Thanks, Dr. Murphy.
Great, thank you.